It's been 5 years since the World Health Organization declared that COVID-19 had become a global pandemic. Since then, the lives of everyone on this planet have been affected by this disease in numerous ways. I remember looking at the numbers generated by the World Health Organization at that time, and I wondered to myself, was the reaction that we were all seeing really necessary? In the end, I put my trust in the public health officials who were advising our various political leaders, and I hope that the actions we were all taking in mid-March of 2020 were going to be enough to avert some kind of disaster. But did we avert some kind of disaster? In the wake of the pandemic, a lot of people are convinced that the actions we took were massive overreactions that caused irreparable harm to our economies, our social lives, and even our collective mental health. So let's ask ourselves, just how bad could have the COVID-19 pandemic gotten here in Canada if we decided to do nothing at all? How bad could this have been had we decided to have taken no major action whatsoever to slow or stop the COVID-19 cases occurring, and we just, let her rip, so to speak? If we want to ask ourselves that, we should first ask ourselves, how exactly would we even model something like this? So it turns out that a lot of the mathematical heavy lifting needed to model something like this has already been done. Two Scottish scientists, Kermack and McKendrick, published 3 papers in the early 20th century outlining what is now known as Kermack-McKendrick theory. Their papers are so important to epidemiology that in 1991, the Bulletin of Mathematical Biology republished the papers, which I'm going to be linking to down below. Kermack and McKendrick based their theory on the earlier works of 2 English scientists, Ross and Hudson. It's from the work of these 4 that we get what are known as compartmental models in epidemiology, the most basic of which is called the SIR model, which goes something like this. Let's say that a population can be classified in compartments as either being susceptible to infection, actively infectious, or removed. Individuals will move from susceptible to infectious to removed. Kermack-McKendrick theory says that the number of individuals in a population moving from susceptible to infectious is equal to some reproductive number multiplied by the product of infectious individuals and susceptible individuals divided by the population. Kermack-McKendrick theory goes further by saying that the number of individuals moving from infectious to removed is equal to a removal rate times the number of infectious individuals. All of this assumes a constant population size. We then get the following differential equations to be solved for. However, there are a few problems here. Firstly, there's no way to form an analytical solution to those equations. If you want to solve them over a specific period of time, you have to use a numerical method such as Euler's or Runge-Kutta, which we'll cover later. 2. Populations are dynamic. Babies are born who are susceptible to the disease, and people will die for a variety of reasons. Oh right, and if the disease is anyway fatal, then you have to account for people dying of that disease. 3. It can take a while after being infected by a disease to actually be infectious. That brings into account another compartment called exposed, which isn't that difficult to account for. 4. With some diseases, you lose your immunity over time. This is something that should be also accounted for. And that's especially true for COVID-19 because people were, and still are, getting it multiple times. 5. Vaccinations. For some diseases, it is possible to vaccinate individuals against that disease. And wouldn't you know it, COVID-19 is one of those things we can vaccinate for now. This leads us to a SEIRSDV model, which will look something like this. The removed compartment is now split up into recovered and dead. Individuals will now flow from susceptible to exposed, exposed to infectious, and infectious to either recovered or dead. while at the same time, susceptible individuals can be vaccinated. Oh, and let's not forget that recovered individuals can flow back into being susceptible. Babies can be born into the population being susceptible to the disease. Finally, we have to remember that people will pass away from other reasons. That gives us the following equations. Oh, and I should probably explain what the dots mean over the variables on the left-hand side. If, say, a letter like N has a single dot over it, that means we are dealing with its first derivative, that is, the rate of its increase or decrease with respect to time. But it turns out I'm forgetting another important category to compartmentalize: hospitalizations. If we recall, one of the chief reasons our political leaders and public health officials were telling us to stay home as much as possible and limit contact with others wasn't just to limit the spread of COVID-19. It was to keep hospitalizations down due to COVID-19 as much as possible. Why? Well, because there's a finite amount of hospital beds and, more importantly, medical staff who are able to treat the sick. If the number of people who have COVID-19 is above the capacity for the medical system, then deaths are going to spike. Thus, we can model hospitalizations by creating subcompartments of the infectious compartment, namely hospitalized and unhospitalized. Similarly, we can derive equations for the flow of persons to or from the hospitalized compartment, which gives us the following two equations. Assuming that those that are infectious but hospitalized are isolated from the rest of the population, then we get the following equations. One thing to note here is that the number of new deaths should now be proportional to the number of individuals hospitalized. If you recall, earlier I said that you can't solve these equations analytically. That's just a nice way of saying you can't come up with nice equations to solve for these things over all of time. But you can solve these equations numerically, assuming you know the initial values of the variables. We'll cycle back to that last part in a bit, but let's show how we will integrate these equations. A common method to integrate equations like these numerically is to use Euler's method, as seen here. Now, Euler's method is incredibly simple to do, but it's a first-order solution, meaning that errors can end up compounding themselves over time rather quickly. Instead, we're going to use a method called Runge-Kutta, which is a fourth-order solution and looks more like this. Yes, there are a lot more steps, and it looks much more complicated, but it is far more accurate. Now we come to one of the more painful questions. How do we find our initial values and our coefficients? Remember these? These are the equations we derived earlier. In order for us to model this numerically, we need values for those 9 Greek letters in red, and the initial values for our 8 compartments in blue. That's 17 values that we need. How do we find or even calculate those? Well, it turns out we can derive or estimate some of these pretty easily. The number of births per day, well, we can get that from Statistics Canada. The non-infection fatality rate, well, that's something we can derive from data we can get from Statistics Canada. The starting population, well, that's something we can also get from Statistics Canada. And let's just not include vaccinations in our model. I mean, we're trying to find a worst case scenario here. That still leaves us with 13 values. I mean, it's not great, but there should be a way to at least estimate them, right? Here in my home province of Alberta, the government was having video updates each weekday during the fall of 2020, and they were updating their website with the numbers of known new cases, the active cases, hospitalizations, and deaths due to COVID-19. From the 29th of September to the 3rd of December of 2020, Alberta saw relatively slow but concerning growth of COVID-19 until new restrictions were put in place. Using that data, along with some fancy Python scripts that I wrote, I was able to estimate the initial values and rates that were occurring during that 65-day period. This is what I got. As you can see, when we integrate those equations with what was generated with my Python scripts, we get shockingly close results to what was observed here in Alberta during that 65-day span. Also, it seems as if the Alberta government was within 20% of knowing just how many new and active cases were occurring in the province during that period. So let's start with the Greek letters, shall we? Now, some of this might look like a bunch of gobbledygook to you, and that's okay. What you need to know is those earlier graphs you saw were produced with these rates. The non-Greek letters, those initial values, aren't incredibly important to what's going to happen next because those numbers were just for Alberta. But for the sake of transparency, here they are for my Alberta model. But we aren't dealing with the worst case scenario for Alberta in the fall of 2020. We're talking about the worst case scenario for Canada starting in March of 2020. And again, we could pull some of the numbers from Statistics Canada and from Canada.ca's website for COVID-19. And we're going to select as our start date being Friday, the 13th of March, 2020. Why that particular date? Because that's the date that the federal and provincial governments here in Canada realized, well, the poop was hitting the fan. These are the numbers I'm using for my starting conditions. And we're going to model this for 1 year. All those Greek letters are going to stay the same with the exception of one. Why? Well, during the fall of 2020, there hadn't been a lot of mutations yet in the SARS-CoV-2 virus, the virus that actually causes COVID-19. So it should be safe to keep the values of all those coefficients the same, except for beta. The value for beta, the infection transmission rate, that I calculated was present under certain restrictions just in Alberta, and it produced a reproductive rate of around 1.8. However, we want to model this for just how bad it would have gotten had all our governments done nothing at all across Canada. Thus, we have to increase the value of beta, but doing so is kind of a guess on how much to increase it by. I mean, how much did the restrictions and guidance really limit the spread of the virus? So we're going to take a guess, and we're going to double the value of beta. Finally, we have to remember that as hospital capacity hit its limit, that would increase the rate of deaths substantially. Thus, as hospital beds get full and the medical system is strained, we'll see the number of deaths spike considerably. Are you ready? Let's go to the first chart. This first chart shows the number of active and exposed cases of COVID-19 in Canada. As you can see, active cases would peak on the 28th of May with more than 11 million active cases, which would be nearly a third of all Canadians being sick at the exact same time. Now, I'm not a medical expert, but that seems bad. What about hospitalizations? This is where things get really concerning. The need for hospitalizations would be peaking on the 30th of May. However, we would have reached the capacity for regular hospital beds earlier on the 28th of April. Oh, it gets worse. A closer inspection reveals that the need for ICU beds is well above what is available. The 18th of April is when ICUs would have become full of COVID-19 patients, meaning that deaths would actually start to spike after that point in time. Speaking of deaths, how bad would that get? The rate of deaths would have reached their maximum around the 30th of May, and we would have been facing approximately 28,000 deaths a day in Canada by that time. In the end, this model shows that had nothing been done during that first year here in Canada, we would have faced 1.8 million deaths due to COVID-19. That's about 4.8% of all Canadians dead. Why? Because when it comes down to it, our medical system would have not been able to handle the caseload. And even if we had infinite medical resources, if we'd let this burn through our entire population, my model shows it still would have killed more than 934,000 people in that first year. That has to be compared to the 22,000 people who actually died of COVID-19 during that first year. I have literally rerun this model dozens of times, and I keep coming back to the realization that if we had let this thing burn through our population, as some say we should have, that millions of Canadians would have been needlessly dead. Overall, the reaction by our various governments in mid-March of 2020 to the COVID-19 pandemic, reactions that were done based on the advice of public health officials, it was probably the right call. Yes, a lot of the modeling they used was inaccurate, but that was largely because they had an incomplete picture without full numbers. Hindsight is always 2020, and it shows they were most definitely made that right call. Some of you watching this video might wonder why I made it. And the truth is that I made this video in hopes of educating people. I am not a plant by any government or organization. I did all the work for this video on my own, and I was not paid by anyone to make it at all. I'm not a member of any political party or advocacy group. I am literally just a guy who's really good at mathematics and modeling things on computers, especially with spreadsheets. All the sources I used for this video, including the spreadsheet that I used, will be linked down below. I totally encourage you to review everything and point out any technical errors I have made in this video. And I also encourage you to share this video as much as possible. My name is Brad, and if you made it here to the end, I hope you learned something here today. Goodbye, and God bless.